Hello friends, welcome back to my channel Nursing Guru 24. Today we will discuss briefly about bronchitis, bronchiolitis, pneumonia and bronchopneumonia. We will see the definition of these disorders and signs and symptoms and brief management. Before proceeding with bronchitis and all, first we will see the anatomy and physiology of respiratory system. As we all know, human respiratory system is consisting of nose, pharynx, larynx, trachea, bronchus, that is left bronchus and right bronchus, then bronchioles, branches of bronchi, then alveoli and two lungs, left lung and right lung. These are the parts of human respiratory system. The human respiratory system is divided into upper respiratory system and lower respiratory system. Nose, pharynx and larynx comes under upper respiratory system. Then other parts, trachea, bronchus, bronchioles, alveoli and lungs comes under lower respiratory system. This is brief about anatomy of respiratory system. Next, directly we will move on to the definition of bronchitis. What is bronchitis? Bronchitis, as the name suggests, we all know itis means inflammation. Itis means inflammation. Bronchi refers to bronchi. Here bronchitis refers to inflammation of the bronchi, either left bronchi or right bronchi or inflammation of both bronchi. Usually bronchitis is caused by viruses. And bronchitis is more common in smokers, those who smoke cigarettes. Then in bronchitis, productive cough will be there, wheezing will be there, chest discomfort will be there. These are some signs and symptoms which we can observe in bronchitis. Bronchitis is the inflammation of bronchi, usually caused by viruses, and this is more common in smokers. Productive cough, wheezing and chest comfort are the signs and symptoms of bronchitis. Next we will see bronchiolitis. What are bronchioles? Bronchioles are the branches of bronchi. Bronchioles are these are the bronchioles. Bronchioles are the branches of these are the branches of bronchus. Here bronchiolitis refers to inflammation of bronchioles. Inflammation of bronchioles. Bronchiolitis is more common in infants and young children. Bronchiolitis is more common in infants and young children. Usually bronchiolitis is caused by RSV. RSV is the virus. Which virus? Respiratory syncytial virus is the virus which causes bronchiolitis in infants. Runny nose, wheezing, nasal flaring, retractions, difficulty breathing, Bronchiolitis is the inflammation of the bronchioles. Bronchiolitis is more common in infants and young children. Then bronchiolitis is usually caused by respiratory syncytial virus. Runny nose, wheezing, nasal flaring, retractions and difficulty breathing are the signs and symptoms of bronchiolitis. What do you mean by retractions? Retractions means pulling in chest wall, taking back the chest wall. That is called as retractions. These are the signs and symptoms of bronchiolitis. Next, then how to manage bronchitis and bronchiolitis? The management of these disorders includes supportive management. Supportive management that includes hydration, means giving more water and rest, humidification, etc. Then specific management of bronchitis includes cough suppressants and bronchodilators. Cough suppressants and bronchodilators helps to manage the bronchitis. Then management of bronchiolitis includes O2 therapy. Such children needs oxygen therapy by mask or by HFNC, high flow nasal cannula. This is how we will manage bronchitis and bronchiolitis. Next we will see pneumonia and bronchopneumonia. What is pneumonia? Pneumonia and bronchopneumonia are the lung infections. When the infection of bronchus, spreads to alveoli, when the infection of bronchus spreads to alveoli, then that is called as pneumonia. Pneumonia is the infection of alveoli. As we all know, alveoli are the small air-filled cavities where exchange of gases takes place. When they are inflamed, there will be impaired exchange of gases. What is pneumonia? Pneumonia is the inflammation of alveoli where there will be altered exchange of oxygen and carbon dioxide. What happens when there will be pneumonia? When there will be pneumonia, the alveoli are filled with fluid and pus. In pneumonia, alveoli are filled with fluid and pus. Hence, there will be impaired exchange of gases. Then, what is bronchopneumonia? What is bronchopneumonia? Bronchopneumonia means patchy infection that spreads from bronchi to multiple areas of lungs. Bronchopneumonia means it is the patchy infection that spreads from bronchi to multiple areas of lungs. Means it may spread to alveoli, it may spread to lung parenchyma. That is called as bronchopneumonia. Pneumonia means it is the inflammation of the alveoli, but in case of bronchopneumonia, infection spreads beyond alveoli. Basically, bronchopneumonia is the combination of bronchitis and pneumonia. Bronchopneumonia is the combination of bronchitis and pneumonia. Next, we will see signs and symptoms of pneumonia and bronchopneumonia. fever, chills and productive cough will be there in pneumonia and bronchopneumonia. Tachypnea will be there. Chest pain, bronchi, sick looking. These are the some common signs and symptoms of pneumonia and bronchopneumonia. Fever, chills and productive cough will be there. Tachypnea, increased respiratory rate will be there. Chest pain will be there, that means chest discomfort will be there. Bronchi will be there and child looks like sick. Next, how to manage pneumonia and bronchopneumonia. Usually pneumonia and bronchopneumonia requires hospitalization. We need to admit that child or that person to hospital. There the medical management includes antibiotics and IV fluid therapy. Then based on the condition, that patient may require O2 support either with the help of mask, by simple mask, or with the help of HFNC, high flow nasal cannula. Sometimes I told there will be fever and chills. For that the patient may require antipyretics and analgesics. Then in later stage patient may require chest physiotherapy, and hydration is very important. This is how we will manage the pneumonia and bronchopneumonia cases. Next, as a nurse, our role is to assess ABCs, that is airway, breathing, circulation, and monitor sputum. Monitor sputum for consistency and color. Then health education. These are our roles. This is brief about bronchitis, bronchiolitis, pneumonia and bronchopneumonia. If you found this video is helpful for you, please subscribe my channel, like the video, share the video, hit the bell icon, then comment me if you need some other topics and if you have any doubts. Thank you.